Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us again this week, Kim Magalhaes. She's the Director of Masonicare at Home and the Interim Executive Director of Masonicare at Ashlar Village. Welcome, Kim. Thanks for joining us today.
Thank you for having me, Sandy.
It's a pleasure to have you. As we continue to reopen our communities slowly, we'd love to hear from you how the process is going there, and also your reflections on the vibe of our residents and clients that we serve.
I'm happy to. So we began our reopening process here in Ashlar Village March 1st. And since then, we have slowly began our dining services reopening, activities in the community, small group gatherings. It's been really exciting. We continue to expand upon that even today, allowing visitors to come in, visitors to enjoy our common areas, making reservations in our pavilion for those who may want to enjoy that space. The vibe has been really good. Residents are thrilled just to get back to some normalcy. You know, the social engagement piece is huge. Just seeing folks come out. I was mentioning this week our eatery, the Duck Inn. I haven't remembered the last time it was that busy. And just to see people smiling, laughing, being together, and knowing that we're getting through this together. And there is light at the end of the tunnel. And the residents, they've been so great about, following our protocols and doing what we ask them to do because we want them to be safe. We have their best interests at heart, following our masking protocols, and that is still in place here, and it applies to our visitors, our staff, and our residents. And if we can do that, the more we can reopen and enjoy our times together. So the vibe is really good up here, Sandy.
That's great to hear. Thank you so much, Kim. And JP, the past 14 months have been unprecedented for all of us, and we're all anxious to feel some sense of relief. But along with that, we do ask our Masonicare family to continue to be vigilant.
Thank you, Sandy. We absolutely have to continue to stay vigilant, even though the number of cases in the state of Connecticut has continued to decline. That doesn't necessarily mean we're not seeing cases throughout the state of Connecticut. More specifically, we've had a few cases in our own system in the past few days that really have kind of reaffirmed why we still are staying as vigilant as we are. The fact that we are opening up and we're gradually opening up is extremely important, but we still are very concerned that we do not want to see a super spread or any sort of spread as we move forward. I was at a special event yesterday at the healthcare center, and we were serving salads to our staff, and I can't tell you, that was really the first time in a long time, 14 months, that I had the ability to serve to the staff, and I can't tell you how much I missed that. It was truly amazing. Today, I was actually up at Ashlar Village at the Duck Inn, meeting with one of our residents, and same thing. Still had to wear a mask, but that energy level has just skyrocketed, and being able to wave and say, hi, how you doing? And hearing such positive comments from our residents, I think it renews a lot of the energy that has been sapped from us all over the past 14 months. So I am extremely excited. However, I am still cautiously optimistic that we are through the tough parts that we went through over this past 14 months. And I think the last is I do want to thank all of our staff for everything that they have done. I know everyone is tired. I know everyone is looking for that normalcy, and we are this close. We are just about there. They have done an amazing job. And to our residents who have really had to endure so much over this 14 months, it's a thank you to them. Thank you for allowing us the opportunity to serve them the way that we have over this 14 months and look to continue to serve them for a very long time thereafter. So thank you, everyone.
Thank you, JP. As you say, we are indeed Masonicare strong. Turning to medical news, Dr. Schwartz, as we all know, last week, the CDC issued new guidance regarding the use of masks for fully vaccinated people. This news has caused a range of reactions. Can you break it all down for us?
Well, I can certainly try, Sandy, and there is a lot of news and it can be confusing, but first let me join JP in welcoming Kim. You know, it's been great to work with Kim, to get to know her, see all her energy and how she cares for the residents. And, you know, one of the best things I learned is I can actually pronounce Magalhaes. I can actually pronounce it correctly, which I couldn't do a year ago. So it's all been for something positive. And now we turn to COVID and the CDC. So once again, I thank you, Sandy, because you helped me find this really nice article. It was actually a long article. It was a 13-page article, but I condensed it to a page and a half for you to try to move this along. But the article is entitled Confused by CDC's Latest Mask Guidance. Here's what we've learned. So I'm going to read some, like I did last week. There's some really good questions that generally people ask and a very brief answer as to where we are right now. So first, I'll start with a quote from the CDC. And this is what they say, that fully vaccinated people can resume activities without wearing a mask or physically distancing where required by federal, state, local, or territorial laws, rules, and regulations, including local business and workplace guidelines. So the first question that was asked was this change based on science? And the answer from the CDC was yes, it was based on the current state of the pandemic in the United States, along with evidence that the vaccines are extremely effective in the real world. So you may know Rochelle Walensky, she's the CDC director. She said last Thursday, that science in conjunction with all the epidemiologic data that we have really says now is the moment. So here's another question. Does CDC's announcement change my local rules? And the answer is not automatically. The public health system in the United States is decentralized. So you probably know the CDC doesn't run or oversee and can't overrule your state or local health department. It just provides support, partial funding, and guidance. So you'll still need to check the local rules where you live to see if they've changed and how they've changed in response to the shift in CDC guidelines. So this is another kind of practical question. What about going to the grocery store or the office? So whether you need to wear a mask indoors in public venues depends on local mandates and guidelines, as well as businesses which make their own operating decisions. So CDC's guidance for businesses hasn't yet been updated since the change of these recommendations regarding masking for people who've been vaccinated. And what about schools? So you probably can realize schools are a bit different from businesses because kids under the age of 12 are not yet eligible to be vaccinated. So the CDC really hasn't revised its K-12 school safety guidance yet. And how do I know, this is a good one, how do I know people around me are fully vaccinated? So what's the answer to this one? You don't. So the federal government has declined to pursue the idea of vaccine passports that would verify someone's vaccination status as a way of allowing them to follow a different set of rules. And this one, and this kind of pertains to you, Sandy, I have little kids who are unvaccinated. How does this change our risk? So many millions of children in the United States are unvaccinated, while adolescents over 12, they just recently got approval to become eligible for Pfizer's COVID-19 vaccine. It'll still take 2 weeks after they get their final dose before they're fully protected. And you know, children and adolescents can still get sick from infection with this virus and they can infect others. And even though generally children and adolescents can get milder infections, they as well have been noted to get some serious complications. So we're almost done. We got just 2 or 3 more questions to go. So this one, I'm immunocompromised. What about me? So there's a research fellow from Johns Hopkins named Dr. Brian Bayarski, and he's been studying vaccine efficacy in immunocompromised people. So what his quote was the CDC guidelines are largely for people who have normally functioning immune systems. The big takeaway so far is we do not yet know the full effectiveness of the vaccines in immunocompromised people. And then what about on planes, trains, and buses? Do I still have to wear a mask there? So according to, again, this Director Walensky, right now we still have the requirement to wear masks when you travel on buses, trains, and other forms of public transportation, as well as airports and stations. And the final question of all, and probably the most important, does this mean that the pandemic is over? And the answer to that is certainly not. Though it is a sign that health officials think the United States is on the road to emerging from it. But technically, the definition of a pandemic is a major disease outbreak that spans multiple countries or continents, and still COVID-19 at this time fits that bill. So again, a quote from Director Walensky, this past year has shown us that this virus can be unpredictable. If things get worse, there's always a chance we may need to make changes to these recommendations. But we know that the more people who are vaccinated, the less cases we will have and the less chance of a new spike or additional variants emerging. And in addition, although in the United States, vaccines are widely available and cases and hospitalizations are declining, it's not the case in many other countries. So each week, more than 5 million people around the world are newly diagnosed with the coronavirus. And cases and deaths are spiking in several countries, as you probably read about, in Southeast Asia, Western Pacific, including India, Bangladesh, Philippines, Japan, and Malaysia. So it's for this reason that we do these videos and we make these statements about the importance of wearing masks and continuing good health practices. And that continues to be important for all of us. So now I give my weekly inspirational quote that helps us get through to another week. And this quote actually, JP and I talked about last week. It did come from the Masonicare Charity Foundation calendar, and we both liked it. And it said, "Don't ask for an easier life, ask to be a stronger person." And I tried to find who said that. I Googled it, and the different names came up. The most frequent name was JFK, so I put that down. But you can see what this means in relation to the pandemic. You know, this pandemic didn't give us an easier life, but I think it made all of us stronger in working together. So once again, I thank everybody for their hard work, their diligence, and once again, I wish you all health and peace. Thank you.
The perfect words send us on our way today. Thank you so much. And thanks to all of you for sharing your time and all of your insights with us. And of course, we thank you for joining us once again from home. Until we see you next time, we hope you'll stay safe and stay well.